Welcome to the Department of Neurosurgery at Policlinico Umberto I, Sapienza, University of Rome. I'm Luigi Berra, neurosurgeon. Tumors of the sacral region, of which chordoma is the most frequent, are tumors that affect the spinal canal at this level and involve the sacral and conjugal roots, which are implicated in bladder function, bowel sphincter function, and sacral function. This means that when the tumor surrounds the nerve, to completely remove them, it is necessary to resect the nerves. Completely, radically removing the tumor means long disease-free survival and, in some cases, definitive cure. The outcome of this surgery, however, is severe disability, characterized by definitive, permanent urinary incontinence, with the need of catheterization, fecal incontinence, and disturbance of sexual function, particularly impotence in men. The alternative to such an emulative treatment is to perform a piecemeal or intralesional excision. This surgery is done to spare the nerves and associated function, but with this treatment, oncological radicality cannot be achieved. This results in recurrence, disease progression, and reduced survival. Finally, there are modern treatments such as radiotherapy or radiation therapy, which uses protons or carboions. This type of radiotherapy is more effective on slow-growing tumors, which are the ones we are talking about, where conventional radiotherapy is not very effective. But even in this case, the risk of doing damage exists, and in any case, the guarantee of having removed the mass and not having a recurrence of the disease in the future is not equal to that of radical surgery. So often the surgeon, but most importantly the patient, is faced with a dilemma. Try to achieve oncologic radicality at the cost of permanent damage, or control the disease less effectively, but with a better quality of life. So, prioritize survival or prioritize quality of life, but compromise future disease-free lifespan. I've been involved in this type of surgery for many years, and I've always been very frustrated by the heavy postoperative outcomes, by seeing the huge complication of this type of surgery. Therefore, after long years, after cadaver and animal studies, I developed this new technique that involves complete removal of the tumor lesion and contextual reconstruction of the nerves that are dissected. This is a very complex procedure, often requiring a multidisciplinary team, and involves microsurgically isolating the nerves in the tract before and after the tumor. The nerves are then searched with a microscope before they enter the tumor and after they exit the tumor. When a sufficient neoplasm-free margin is found, these nerves are dissected. Then the stumps are reconstructed with nerve grafts taken from the same patient. With this type of treatment, which is very complicated, very long surgery, I have obtained very good results. That is, a recovery after a few months of sphincter function and also sexual function. I hope to be able to treat more and more patients with this type of problem, so as to have a positive impact on this disease, whose course to date is very negative. Finally, I hope to spread this technique and teach it and pass it on to my colleagues around the world.